Mrs. B started having a leaky bladder after her third child, notably whenever she laughed hard. The problem worsened as she grew older, and by the time she was in her 60s, she was wearing a pad purchased at the local pharmacy. Mrs. B finally came in to the doctor for help and asked about medicines that promised help for incontinence that she had seen advertised on TV and in magazines. The doctor referred her to physical therapy to help her learn pelvic muscle exercises, and after a second patient plea, also prescribed the medication requested. The patient didn't do the exercises, but took the medicine, which was quite expensive. Over the next 3 months, she noted maybe some improvement with leaky bladder, but she still needed pads, and she began experiencing problems. Side effects included constipation, dry eyes and mouth, blurry vision, insomnia, headaches, and depression. Also, she had recently fallen several times. This is not an uncommon story. About 1/3 of all women older than 60 years of age experience some level of urinary incontinence, and this is twice as often as in men. Incontinence in women is generally the result of previous pelvic surgery or childbirth or menopause. In men, it's generally the result of benign or malignant prostate growth, blocking the urethra and bladder exit, which can cause an overexpanding of the bladder. If that dilation lasts for too long, this in turn can cause loss of bladder contracting strength and worsen the problem. In men, it's important to remove the blockage by either shrinking the prostate with medication or surgically opening the pathway before the bladder becomes overexpanded for too long. In women, the medications are much less helpful and have safety issues, especially in older women. The most important way to help women starts with pelvic floor muscle strengthening exercises, and the sooner the better. Also, there are bladder training techniques, pelvic surgeries, and even bladder stimulation devices that can help. Experts advise slow tightening and relaxing the pelvic floor muscles like 200 times a day, whenever you think of it. Make it a habit tightening the pelvis whenever you smile, and smile often. That would help women and men alike. Bottom line, especially in women, medications can only be of minor help, but carry with them dangerous side effects and cost. Pelvic floor muscle strengthening exercises are more effective than meds, without side effects, inexpensive, and underutilized. Do it with a smile so you can laugh without worry.